According to the Pan American Health Organization, growing rates of obesity, poor diets, and lack of exercise have contributed to the amount of adults living with diabetes in the Americas to triple. It's a disease that continues to plague the Bahamas, and health professionals continue to push the general public to educate themselves on how to prevent and manage diabetes, a disease dubbed by nurse Anita a silent killer.
Because often there are no symptoms. So let's talk about the no symptoms. So highly recommend that everybody goes to see their general practitioner and they get their bloods checked annually. You're looking for your fasting blood sugars, and you're also looking at something called the A1C test. So in pre-diabetes, there's no symptoms at all. We just see it in the blood sample itself. So it is a medical diagnosis that way. As diabetes develops and the blood sugars get higher and higher and higher, this is when you may or may not get symptoms.
Symptoms of onset diabetes can include dizziness, frequent urination, thirst, blurry vision, and weight loss. Dr. Ariane Davis-Simmons speaks to some of the trends she's seen in the Bahamas while treating patients.
Type 2 diabetes is the most common form of diabetes. So that's 90% of individuals who have diabetes will have type 2. Because type 2 diabetes is very much linked to being overweight and obese, that's one of the major risk factors. We are seeing onset at a younger age because we're seeing more obesity. So even in children, we're seeing pre-diabetes and diabetes if there is a coexisting obesity. Tend to see more females just because females tend to seek care earlier and do more preventative care than men. But that does not mean that there's more disease prevalence in women in comparison to men.
PAHO has called on countries to do more to reduce diabetes rates in their country, as if the current trends continue, the number of people with the disease in the region could grow to 109 million by 2040. Both health professionals have this advice and warning of complications for the public.
What really works is a reduction in, first and foremost, the sugars in your diet. So choose to put them on one side. So these would be sugary drinks. That would be one thing, your Coke sodas and your juices and all these types of very sugary drinks. And also don't overconsume coconut water, even if it is from the tree, because that too can have a lot of sugar in it.
So complications of diabetes can all be prevented with good sugar control. However, if it's not controlled, then you have the complications. So that can be micro complications such as blindness, kidney disease, neuropathy, so numbness and tingling in hands and feet, which increases the risk of amputations. It can also increase your risk of heart attack and strokes.
Be sure to visit acediabetes.com if you have any more questions. Tyler Simonet, EyeWitness News.